The HTS Expected Discharge Function Score Calculator, a total game changer that transforms discharge planning for therapists and healthcare providers. With the HTS Calculator, complex formulas are automated, delivering accurate expected discharge scores in just minutes. Before we show you the calculator, let's talk about why your team will want to use it right away. The Discharge Function Score isn't just a tally of GG scores. It's a risk-adjusted measure built by CMS to track how well each facility helps its residents improve their functional abilities. But this score isn't just a number. It's a big-picture look at patient outcomes, and it takes a team effort. That's why your entire IDT needs to be on board. Plus, these scores are public and could soon be tied to reimbursement and financial performance. Now, let's jump into the calculator. The first page of this tool provides the purpose, calculator instructions, and other important pieces of information. To start using the calculator, navigate to the Admission Function Score on tab 2. For our example, we've entered information for GG items that are compiled into the initial scores CMS uses for calculation purposes related to quality measures. You can also use this page to enter interval coding. After the Admission Function Score populates, navigate to the Expected Discharge Function Score located on the third tab. Column B is the only place on this page that an input is required from you. To see this calculator in action, we will briefly guide you through an example. In the age category, for our example, we input 75. For the primary medical condition category, scroll over to Reference Table 1. Using the drop-down menu, select the appropriate category for this cell. We selected 12 for medically complex conditions. Prior surgery, we selected No. Prior function, enter a value using Reference Table 2. Using the drop-down menu, select the appropriate value for this cell. For our example, we selected 2. Prior device use, enter a value using Reference Table 3. Enter the appropriate value in this cell. For our example, we input 1. Continue down the page and input information in all of column B. After completing this, the Expected Discharge Function Score will populate in green, which you can then share at interdisciplinary meetings to guide discussion and care planning for the patient. At HTS, we're committed to improving care across the long-term care space. That's why we're offering this calculator as a free resource. We simply ask that HTS is credited. Our goal? Better outcomes for both your patients and your organization.